Hello, I am Dr. Dana Eby from Bel Air Physical Therapy, and I am joined with McCager. He's going to be one of my patients for the day as I go over some education and instructions on some exercises. So we're coming to you today just because of the coronavirus and COVID-19. We're trying to stay safe, minimize how many people are in the clinic. So I come to you in my humble abode. So for today, we're going to go over some education just on the upper trap. A lot of people, they're sitting at their desks for prolonged periods, or they're sitting at home for a long time, and they always say that, oh, my upper traps are really tight and they hurt. But sometimes they're actually not tight. They're painful because they're too lengthened. So we'll go over that a little bit. Just keep in mind that these are general recommendations. If you would like some specific exercises, schedule an evaluation with us or leave us a message, and possibly in the future we'll get some virtual visits up as well to help us through this time. So keep in mind doing these exercises at your own discretion. Any concerns or pains, don't do them. Just wait and ask us. Alright, so let me turn this around. Okay, so we are going to go over. Put that there. Alright, go ahead and turn around for me, please. Legs the other way. So, first off, let's go over where upper traps are. The upper traps connect from up here all the way down into here, and then the traps is called the trapezius muscle because there's three parts to it. You have the upper traps right in this area, you have your mid traps right in here, and you have your low traps down here as well. So as far as the upper traps, a lot of people have pain in this area as they're sitting for prolonged periods or with their carrying objects or kids for a while. So this is how we assess it to see if it is lengthened or short. One way. So one way, I'm going to just check his scapular position because the upper traps connect to the scapula. So if the scapula aren't in the proper position, it tells me if it's short or lengthened, the upper traps. So I'm just going to check right here. Go ahead and look up to the sky for me. Good. And back to the center. So, oh, wait, to the center. Thank you. So this is C6. You have 7 cervical vertebrae. This is 6. We're going 7, 1, 2, and 3. So this is his third thoracic vertebrae. So I'm just going to run my finger across, and I come into the shoulder blade right about here, and the shoulder blade is just a little bit depressed, meaning that this shoulder blade should be up right in here, but I can feel in the bony parts of it that it's a little bit lower. So that may tell me that his upper traps are lengthened because they're not in the proper position. So those may cause pain. Do you have any pain up in here, by the way?
No.
Okay. Alright, so go ahead and turn around facing me. Another way we can check is called the clavicular angle. So right in here, I'm going to pull this down. Is that okay? Mm-hmm. Sure. Okay, thanks. So the clavicle, clavicle comes right in here all the way down where it connects to your sternum. So we can check, so go ahead and relax your arms right here. So we can check the angle here and see, we'll just put that up there. Alright, so the angle right here should be about 15 to 20 degrees. I'm at home, I don't have my goniometers, but if you come to the clinic, we can definitely assess this for you. So right here, it does seem to be a little bit lower. It should be just a smidge higher towards in a little bit more angle like so. So this further indicates that he may have some depressed scapulae, his shoulder blade, indicating his upper traps are lengthened. So just in case you have a tight upper trap, let's go over an exercise. So at home, don't have many fancy equipment. We're going to use just a strap for this exercise. So we're going to stretch his left upper trap. We're going to put one part of the band right here at the base of the neck where his shoulder meets his neck. He's going to hold this down, one arm right here, down here. And one arm is going to hold the other side at the back here. So he's going to hold this down so it holds basically his shoulder blade and his clavicle, everything down as he moves his head to the right. So in doing so, make sure you keep, so he did the mistake I was wanting to point out to y'all. So as you bring your head out to the side, make sure you keep your head straight with your nose pointing straight ahead. What we don't want is you to turn your head this way. That actually doesn't stretch the upper traps as well. So we want to make sure it's straight across, and you're holding this down to basically stabilize this part as you move your head to the side. Beautiful. And you can do that for about 30 seconds, 3 times on both sides, because you have 2 shoulders. Or you can use it as a movement pattern. Basically, you can stretch it, and then once it feels better, you hold it and move your head to the side 10 reps on each side. Okay, so for McCager here, he has lengthened upper traps. Let's go over an exercise to strengthen them. Because if they are long, here, come on over, right there. Because if they are lengthened, if they're longer, we need to make sure we strengthen them, because when we strengthen them, the muscle fibers actually get a little shortened. And in doing so, we have to strengthen these muscles whenever they're in a shortened position, so we can change the fibers and the length so that they pull the shoulder blade up again. So these are called serratus wall slides. So he's going to start facing the wall, 1 foot in front of the other. Thank you. Arms about 90 degrees right there, and make sure his arms and forearms are parallel. So fix that right arm a little bit. Good. So they look like goalposts. So what he's going to do, we're going to come right here, is he's going to push his body back for me. Go ahead. Good. And that's going to activate the serratus, which is right around here, to help upwardly rotate the shoulder blade so that your shoulder moves appropriately. And then as he pushes back, he's going to slowly slide his arms up. Good. Keep going. And all the while he's pushing back, keep sliding up, keep sliding up. Once he gets around there, he's going to slowly start to shrug his shoulders up to his ears, to where once he gets to the tip top, his arms are straight, he's a little closer to the wall, and he is shrugging up using his upper traps. So they're tightened there, and they're activated and working while they're in a shortened position. Okay, come back down. Let me show them in this position. So do the same thing again. Feet staggered, arms there, pressing back, sliding up. Once he gets top, slowly shrug, shrug. Good. Very nice. Hold for about 10 seconds or so. You can do about 20 reps or however many your heart desires. Good. And just one more thing, because I'm very picky and want to pick on him. As you are doing this, so as you're doing it, go ahead and do it again. I want you to try not to shrug your shoulders up and forward. This is going to kind of exaggerate that forward head, forward shoulder posture. So as you shrug up, try to use these muscles in the back here where you're shrugging kind of up and back this direction a little more. There you go. That looks a little better. And he is working hard. Good. All right. So overall, we went over how to check upper traps to see if they're lengthened or shortened, and then we went over a couple of exercises to help improve if they're lengthened or shortened. So if you have any questions regarding which exercises you need to do for that upper trap pain, let us know. So that is all for today. Make sure you stay safe, wash your hands, and hope to see you soon.